Hi, my name is Mike Hamilton. I'm a community learning disability nurse based here in Bury. I work for the community learning disability team at Windsor House. I've been involved in this team for the last 4 years, and part of my role is to work with our colleagues in the mental health services over at the Earwell unit. I am a mental health link nurse and LD nurse. I've been fortunate enough to have the opportunity to work over there in the capacity of bank, so that has enabled me to build relationships up with all services within mental health. Part of my role is to ensure any patients with learning disabilities who go into the Earwell unit are given the appropriate support, and what I would try and do is be responsive in a crisis and try and support colleagues who are unsure how to meet a person's learning disability needs. So I would then get onto the ward, support the patients, support the staff, ensure reasonable adjustments are being made. We would look at all aspects of their care and what type of support is required. What we'd think about initially would be looking at some reasonable adjustments at the environment. The environment might be a trigger to their behaviour. Health inequalities might be an issue with their own behaviour as well, so we'd look at what documentation is available to support their admission. Firstly, we'd look at the hospital passport, then maybe a communication passport, then look at the most recent health assessment. Within them documents, that would support what needs to be met. And the majority of the time, this patient group come into hospital they have broke down in terms of where the placement is. They generally finish up going to A&E, and it can then be quite a difficult and stressful time for all persons involved, including the families of these patients. We will enable the family to be involved, ensuring that they're at the forefront of any decisions made with the patient themselves. We'd ensure that the legal framework is in place to support what best needs to be met in relation to their future planning. I think going back to the original support we've offered, there's some examples in recent months and over the last 12 months where patients have come into the Earwell unit, and we've had planned admission where a patient out of area, the care's broken down to a significant point where their physical and mental health was compromised. So a bit of planning with colleagues in the patient flow, which is a bed management, and the Earwell unit to try and just find which would be the best part of the ward this person would be able to be cared for, where it wouldn't increase any further stress to themselves. Looking at support, what they require, generally observations will increase because of their vulnerability on an inpatient ward. An inpatient ward can meet some of their needs, but sometimes their vulnerability can increase based on the type of ward environment, so therefore staff numbers need to be increased to support this person. On the occasions when I've been involved with patients who have come into the Earwell unit, they have, the staff team particularly, have this a little bit of anxiety, which we try and ensure that they can support them the best way they can. We will do some role modelling. We'll work directly with the patients themselves. We'll show good practice in terms of looking at their routine and how the routine can be adapted again in the environment. I think which is really important is being there, being responsive, supporting the team, ensuring the care plans are adapted so they can be easily read for the service users themselves. Ensuring the communication needs are met, and also looking at the wider disciplines of whilst they're there, can we make this journey as short as possible, ensuring that the discharge plan is still active and it's still alive, and it's not a place where at times it can be prolonged due to the difficulty of finding placements within the community which can meet the needs. So particularly the last couple of years, this has been quite effective and has worked quite well within our service, and ultimately it's just trying to establish where is the right place for this person to be and how best we can meet their needs. The benefit of being a link nurse with the mental health services from an LD perspective is to have that name, face, go-to person who can offer some type of leadership within this role. Therefore, it enables the services within mental health just to have that go-to person, and they can take responsibility and ensure needs are being met, and if they have any difficulties in managing any type of situations or having any difficulties with any further links externally within the community, the community nurse can be on hand just to show or point them in the right direction, so they can escalate any future problems or issues which they may be having. So this collaborative working with a clear defined person taking charge enables the service user who's in a place which is not deemed appropriate due to the acute areas of support to be someone who they can go to.